Good morning, everybody. So I'm going to talk a little bit about the work that's going on around integrated digital care, and particularly how TECS relates to that, because I think some of the things that have happened in the past is perhaps when people have been planning for telehealth, telecare, telecoaching, it's not been embedded in sort of the broad stream planning for service transformation and how we do things, just like share care records and everything. And what we're trying to do is sort of bring all of that together and look at capabilities. So in terms of what I'm going to do, I'm going to talk a little bit about the bit of work I'm responsible for, which is local digital roadmaps and sort of what that means and sort of the guidance that's going to be coming out shortly. We'll explain a bit about that, but I'll give you sort of a heads up on that. We're going to talk about the roles of the different providers, both health and care, in helping define those roadmaps, and talk about how TECS fits into this process. So I think the driver behind all of this is if you're receiving a service, you sort of expect that all of the different information sources are joined up and that we can sort of look at them as professionals and decide what's best for you based on sort of really connected information systems. And people shouldn't have to repeat themselves. They shouldn't have to sort of remind people something that they've told the previous person they've seen. And there should be a bit more intelligence around that. But creating that is really difficult. And if we look at what's happened with sort of digital systems, there's been really good progress, I think, within organisations, and there's often quite detailed plans for what people are going to do and how they're going to develop and how technology is going to support the ambitions of that particular organisation. But where it falls down is in the handovers between sort of organisations, and we all receive care from multiple organisations. It's rare that we'll get just one organisation who's providing our services. So what we really need to address is what happens at those handovers. And to do that proactively, we really need everyone in the room, and we need people to start having conversations about those gaps, because that's where things go wrong. And if you look at a lot of the serious incidents, it's usually in those handovers that things have gone wrong, information's been missed or something hasn't happened. So in terms of policy, you've hopefully all seen the 5-year forward view, but how many of you have heard of the NIB, the National Information Board? There's a few, not many. So it's sort of health and care have got together and formed this body called the National Information Board, and it's got Department of Health, LGA, HSCIC, TDA Monitor, CQC. It's got everyone at the table, and it's saying, well, rather than individually us looking at what the policy should be for sort of the digital future, we should do this collectively and together, and we should all be driving in the same way then. We shouldn't have sort of this organisation pushing on one agenda and another organisation going away. It's at odds with that. And so this National Information Board has created a policy document called Personalised Health and Care 2020. And that sets out the future, so I'd encourage you all to read it. Sets out the future vision for how digital technologies can support the vision for the NHS and health local authorities, as well as put forward in the 5-year forward view. And there's work streams that have been set up to help deliver that sort of vision. There's a lot of work around interoperability and what we need in terms of standards to make systems talk to each other. And I know TSA's had a big role in sort of defining standards for the TECS world. But really we need to sort of start where there's gaps, defining what those standards should be so that you can plug and play systems, much like now when you go home and you buy something from sort of the consumer side, you take it home and just expect it to work. Well, we want to get to that sort of idea with professional systems. Related to that, there's something about how do you join up all the levers and incentives there. So recently there's been quite a few incentives with things like the tech funds. So I know a lot of TECS was funded through the NERS technology funds, for example. But we need to, again, align them and also look at levers. So where we have contracts and things, how can we make sure people are using the standards where they do exist so it gives us some chance of having interoperable systems. There's a metric called digital maturity, and this has been out there for some time in sort of the acute sector. But what we're saying now is we need to look at regions. And if we want to improve, we need to know where we're starting from. So this is a set of questions that regions will be asked to sort of answer. It'll just really give a picture of where people are at in terms of this interoperability and how systems and people talk to each other. And that's going to be coming out this year, and it'll give us a baseline really, and it'll tell us where people are. But the next bit is about sort of, sorry, I missed a few slides. And if you look at the things that digital maturity measures, it's something like, the system readiness. So have we got a vehicle for discussing collectively what we're going to do and how we're going to do it? So there are opportunities just when you start chatting about this to align sort of requirements and to align sort of timelines for procurement and things like that. But a key thing is looking at capabilities. What capabilities, if we're heading towards a paperless or paper-light sort of NHS and care system, what capabilities are we really trying to sort of embed within the services? And we heard a lot today about how we share records and assessments and care plans, and there's a stack of activity going on there. We also need to be able to transfer care, so we heard of e-referral and various other things, but that should be between all different types of organisations, not just between sort of GP world and hospital world. We need to be able to communicate in a safe and secure way digitally. We need these decision support tools that cross organisations as well. And we need remote and assistive care, and we need to activate patients. We've heard a lot about the consumer drive. And so what the roadmap, the digital maturity and the roadmaps are doing is taking these capabilities, and there's some others that are non-direct care ones about population healthcare management and asset management, and saying, where are we at? But more importantly, how can we collectively get together and say where we want to be by 2020? And technology-enabled care services, as I say, in the past might have been seen as something sort of standalone, but it shouldn't be now, because when we look at the capabilities, if we look at remote and assistive care, patient activation, and decision support, TECS does all of that. So as part of your roadmap for what's going on, as well as defining what's happening with sharing assessments and plans and records and referring people and communicating digitally between services, we should also be saying, what are we going to do around TECS? The bit of work that I sort of am embedded in is about everyone getting together in local regions, the footprints defined locally, to say, what's our collective vision for how all of this hangs together? So yes, we've got an information strategy for the primary care, we've got one for our major hospitals, we've got one for the local authority, but are they aligned? Are there opportunities that if we just sit down together and talk about what we want, whether we can align that better? And there's a requirement in that NIB paper that says we want sort of interoperable records, and in the end, we want them to be real time, and we want everything to be synced. But as I said, it's not just about the records, it's about what the records enable, and we've seen all of those capabilities. So the reason why we think local roadmaps are important is because everywhere's starting from somewhere different. We've had two visions this morning about sort of where people are at, what their visions is. And I am also Programme Director for New Technology for Yorkshire and Humber. And I think, I've looked at 23 different commissioning intentions. And what I've seen there is perhaps there's a real sort of effort to describe what the service transformation is going to be, but it focuses on what are the implications for the people who are in that system and what are the process implications. And with a few notable exceptions, the technology elements, that how does technology support us to achieve this transformation, is relatively light. So what we're saying is, for now, we need to really pull out that technology component and say, what are you going to do digitally to support your ambition, your service ambitions? And eventually, it'll just become the norm. It'll just be wrapped into the way we do planning. But for now, because there is this gap, we need to sort of encourage that. So we envisage CCGs being the sort of coordinating body to help develop these roadmaps, but everyone has to be involved. If we look at the plans for integrated care and service transformation, it involves a myriad of different providers and commissioners. So local authorities, health and wellbeing boards, we anticipate them playing a very strong role in defining the roadmaps, and so does every provider. Wherever we've been, we've presented quite widely now, and we've consulted with a sort of significant number of local authorities, CCGs, and CSUs, actually. People say, well, actually, we're doing this, but in some places we've got it established and there's a forum for doing it, but in other places it happens a bit more informally. But we've never had anyone say, well, it isn't a good idea, actually, to coordinate what we're doing. It isn't a good idea for us to sit down and discuss this and to share our vision and to see what opportunities that brings in terms of us doing things together, in terms of us perhaps staging things slightly differently, and in terms of sometimes making a compromise where, as an organisation, I have to sort of hold back a little bit on my ambition because otherwise I'm going to jump too far ahead for everyone else. So the guidance should be coming out soon, and really the initial phase is just saying this is what's going to be required, and this is how places that have done this have set themselves up and established themselves. And the places that are farthest ahead on the digital agenda have these forums, they have these discussions, and they have a way of documenting them. Sorry. Rather than just looking at a capability and describing, say, what we're going to do about care records and plans in a region, when we sort of asked people about it, they felt it was better to also align it with a description of a care pathway. And there's a number of reasons for that, but partly it aligns with what people are doing in terms of transformation. But it also enables people to describe benefits much more easily, and it also enables people to include that consumer element. So there's a number of pathways. We're not mandating sort of all of the partners in a pathway, just saying locally you will have a plan for how you're dealing with people with multiple comorbidities. Who is in your patch? What are the handoffs? What are the interfaces between organisations in your region? And how are you doing on the capabilities between those handovers? So there's multiple comorbidities, end-of-life care, urgent and emergency care, and mental health. And so we think if people can describe how technology is going to enable those care pathways, as well as how the capabilities on their own right are developing over the next 5 years, we get a really good picture. And the value often in this isn't the end product, even though it will be valuable because we can share and see what people are doing across the country. The value is really in those conversations and in getting people together. And we know it's happening in a lot of places, but this just, I suppose, puts a bit of structure around it. So, as I said, TECS, for me, having been involved, as many of you will know, a long time in telehealth and telecare, I think this is a real strength and an opportunity for TECS because it's just considered part of the mainstream digital agenda. It's no longer in a separate part of NHS England. It's sort of integrated and embedded within the thinking about everything else digital. People are going to need support to do this. Organisations such as TSA are going to have a role to play where people's sort of knowledge and skills will need to be pulled in, because as we say, it's providers, there's going to be suppliers as well who are informing some of these discussions. And then we've got the other sort of usual suspects. So the thinking now as well is there's some tools going to be developed to help people define their roadmaps. And importantly, the TECS resource for commissioners, I think this is something that will support commissioners to think about how they're using TECS, because, again, the ambition of that document was really to stress, don't just think about TECS for people at the top of that triangle. Think very broadly about how TECS can support people from birth all the way through to death. And I think there's sort of other useful resources as well that say, once you have your roadmap and your plan, how do you make sure that the quality of your implementation is good? So you'll have seen some of these resources. So this is plans into action. It's saying, yes, we've got a roadmap, we've got a 5-year vision. We're going to refresh that annually because technology changes, funding changes. These aren't static plans. We know things move on. But really, the aim is to deliver benefit to professionals, benefit to patients, and so we need to see how those sort of plans turn into action. So in summary, I think for me, there's some sort of really useful things on the horizon. There's the sort of digital maturity metric, which is just saying where are we starting from, but every year, we'd hope that you'd see that maturity metric, you'd see improvement in what people are doing. TECS is just built into those core capabilities that, a paperless NHS and care system needs. There are lots of support resources out there for TECS already, but I think they're really important because once you've got everyone in your patch agreeing how they're going to use these sort of services, making sure you have a quality implementation is essential. Excuse me. But the key thing for me is it's just routine now. TECS is embedded in the digital capabilities, it's embedded in the road mapping sort of process, and it's embedded in the maturity metric. So, and everywhere we go, we hear about new models of care, vanguards, pioneers. People are thinking about how they transform care, and I haven't seen one transformation program that doesn't have TECS as a component in that delivery. So, so I think timing's good. Thank you very much.
Thanks, Tim.